Hi, I'm Selya, and this talk is about how to avoid common pitfalls in observational e-cigarette health research. These are the disclosures of myself and my co-author, Ricardo Pelosa. There are over 100 articles on e-cigarette use and various health outcomes. The typical patterning of results, as shown for this example of cardiovascular disease, is that non-use is lowest risk, followed by exclusive e-cigarette use, followed by cigarette smoking, with the highest risk usually found in dual use. However, most studies are heavily flawed, which prevents us from being able to conclude about direct health risks of e-cigarettes. Meta-analyses compound these flaws because they summarize several underlying studies with the same underlying flaw, so they also reflect that flaw but are considered or interpreted as higher quality evidence because they're meta-analyses. These are the three main categories of flaws that I'll cover in today's talk: confounding, predominantly by smoking history, temporality issues, and poor definitions of exposure. A lot of these problems stem from a conceptual, overly simplistic interpretation of product use as static over time. However, there are different trajectories that are important to consider, as well as important homogeneous subgroups within each category. In particular, it's important to look at smoking history and smoking trajectories or changes in smoking behavior over time for both the e-cigarette exclusive group and the dual use group. In the exclusive e-cigarette use group, while a small percentage of them never smoked, most of them formerly smoked and might have lingering health effects that are in the analysis being interpreted as effects of e-cigarette use rather than smoking. Also, dual use is interpreted usually as additive exposures from both smoking and vaping. However, when somebody starts e-cigarette use and becomes a dual user, often they substantially reduce their cigarette consumption, and that leads to important subgroups or subdistinctions of dual use as well. Most studies adjust for smoking status, meaning current, former, or never. However, this doesn't capture the full range of intensity and cumulative exposures that's important to understand disease risk. Alternatively, analyses can focus on people who never smoked, which avoids the issue of confounding by smoking history. There's also temporality issues in treating product use as a static snapshot. For example, in people who switch from smoking to e-cigarettes, depending on when the survey happened to be administered with respect to that trajectory, they could be categorized as e-cigarette only or as dual use. Even worse, there could be cases of reverse directionality where the health outcome occurred before e-cigarette use, and there could even be reverse causality, such as a sick quitter effect, where people who developed smoking-related illness were motivated to switch to e-cigarettes because of that illness. And in the analysis, that pre-existing illness is bundled into the e-cigarette use group. The third major flaw is poor definitions of e-cigarette exposure. Usually, e-cigarette exposure is defined as any use in the past 30 days. This further complicates some of the subgroups because it could capture people that are transiently experimenting with e-cigarettes at the time of the survey. Or it could include all the way up to prolonged and heavy use, which at least for smoking is required for long-term health effects. Reinforcing the importance of these flaws, Gal Cohen and Steve Cook recently published a best practices paper for analyzing observational data on health outcomes. Although we probably can't completely prevent these flaws given the limitations of existing data, there are some easy steps that researchers can take to mitigate these to a large extent. So not just adjusting for smoking status, but adjusting for detailed smoking history, or alternatively focus on people who never smoked. For temporality issues, it's important to account for where they were coming from, so history and prior behavior rather than what they were doing at the time of the survey. Also, we need better measures of e-cigarette exposure that include things like duration, heaviness, or frequency. So in this talk, we've highlighted some common flaws in articles looking at e-cigarette use and health outcomes. Meta-analyses often suffer from the same flaws as the underlying paper, but unfortunately, they exaggerate the reliability and confidence of these findings if they don't account for those flaws. Many of these harms are partly avoidable, so please do your part either as an author, peer reviewer, or consumer of the research to enforce better standards. Thank you, and happy to answer any questions.